Welcome back. The calendar will soon turn to November, or should we say Movember. The annual event encourages men to grow mustaches and beards. It's all about raising awareness for men's health issues, including prostate and testicular cancer. Joining me now is Mercy Health physician Keith Melvin. Dr. Melvin, want to thank you for being here.
Thank you, Kristen.
So what are some of the issues that men need to talk about more?
Well, of course, you know, everybody knows now that we need to be talking more and more about prostate cancer.
Sure.
But you know, when you're looking at the Men's Health Month, we're talking prostate cancer, testicular cancer, and then now we've really tried to move into the behavioral health and mental illness piece. All of these things are things that guys just historically would not talk about. They won't tell anybody. They won't even tell their wives.
Why?
Well, because it's not the macho thing to do, and we've been raised like that culturally.
All right, so they don't talk about it. Do they go to the doctor more now than they used to?
Clearly they're going to the doctor more, and my practice is, if you come to my practice, I've probably got 2/3 of the office is full of men. But I've been working on this for some time, and I'll say in the past 15 to 18 years, more and more men are coming to the doctor. But we're also going into the community with various types of health fairs and different kind of programs, and this has invited men to understand that it's not that big of a deal. You can get free screenings, and if you come in for a prostate check, while you're there, we can do your blood pressure, check you for diabetes, and do some other kinds of things that we've encouraged for a long time to have men bring their sons with them so that we can break this cycle of men believing that it's not a macho thing to do.
Make sure you're overall healthy.
Well, you should be overall healthy, because it would be a shame to make your wife a widow and your children orphans when you just wouldn't go see the doctor. And you know what? It's okay to be scared. You still have to go.
We have about a minute left. I have two more questions I want to get in. You have a personal attachment to screenings because you yourself are a survivor.
I'm a survivor now for 18 years, and I had a screening done in my own office. My PSA blood test, I didn't have the digital rectal exam, which is not required for a screening. So I had a PSA blood test. The PSA blood test normal is 0 to 4. Mine was 2.7, so the absolute number is not as important as the velocity of the change. So men should know their number, because every year when you have this checked, if the number continues to increase, your risk of prostate cancer increases proportionally. So men need to know their numbers, and if your number continues to increase, even if it's still within normal, you are at risk of prostate cancer. I had prostate cancer with a PSA of 3.1, 0 to 4 is normal. Unbelievable.
You have a big gala coming up that you are inviting 1,800 of your closest friends to.
Absolutely. So this Saturday, November 3rd at Duke Energy Center will be our 10th annual Black and White Cancer Survivors Gala. And this whole thing was started, the idea behind the foundation was to increase awareness, promote early detection through screening. And so what we've done is taught people all kinds of information provided about mammograms, colonoscopies, lung screening, and so forth. And people are there. I have believed that what we'll have this Saturday, like the previous 9 times, is 15 to 1,800 ambassadors that will be able to go out into the community, tell their family, friends, and co-workers how important screening is, because if you get cancer, then it better be early. And the only way it can be early is through screening.
Education.
So this is what we must do.
Love education. Doctor, thank you for joining us
and
for spreading the message.
Thank you very much.
So important.